So we hear the government line, but a lot of questions emerging from you, and here's someone who can possibly, hopefully, answer some of them at 9 minutes before 8, the time I speak, a Conservative MP and Health Minister Ed Argar, who joins me now. We're told that if we're 50 or above, we should contact the NHS now to arrange this booster jab. Is that the correct procedure? And if so, do we call the GPs? How does it work, Minister? Good morning.
Morning, Nick. So what we've done up until now is we've been reaching out and contacting those over 50, those in those cohorts 1 to 9, clinically vulnerable, and of course health workers, saying now's the time to come for your booster jab, because it's 6 months. It needs to be 6 months after your second jab. What we are doing now is we recognise that has worked, but there's more we need to do, because getting jabs in arms is the single biggest thing, and those boosters in, that will help protect us. So what we're saying is, if you reach 6 months plus 1 week and you haven't been contacted, you can now contact 119 on the telephone, or you'll be able to go online. So you can, in a sense, self-refer yourself for your booking rather than having to wait to be called if you reach that point.
What are stocks like? Have we got enough?
Yeah, I mean, the issue, Nick, is people coming forward. So we've got enough jabs, we've got enough vaccine. We've got over 2,500, I think, places in this country which are administering vaccines. And although we haven't got the same number of volunteers, people have gone back to work, furloughs ended, we have got enough volunteers to do it. So we've got the capacity, we've got the people, we've got the places. So the message is, come forward, have the jab. It really will make a difference.
So this isn't Plan B. What would the numbers have to get to, Minister, where the so-called Plan B would actually be put into operation, do you suppose?
Well, Nick, I entirely understand why, for you and for your listeners, they'll want and ideally a clear binary answer to that. And sadly, I can't give you an answer to that, because it's not just about an infection rate. It's not just about a hospitalisation rate. It's about a range of factors. It's about how the disease is behaving, how we're doing with that rollout of booster vaccines, and vaccines, of course, in 12 to 15-year-olds, because it's in that young cohort that we're seeing the biggest spike or rise in infections. And it's also about the pressure on the NHS and how it's coping with that. And sorry, Nick, I think you were about to come back on me there. I heard an intake of breath.
No, I do apologise. No, I'm in good health. Don't worry. I am well, Ed. Don't worry. No, I was just wondering how you were responding to Tony Blair's suggestion that you and your colleagues should be looking at 500,000 booster shots a day. Are you up for that challenge, or is that figure unattainable?
Well, I think what Tony Blair is saying, underlying that point, I'm not necessarily going to sort of agree or disagree with an individual figure, but I think what he is saying is we need to up the rate of jabs going into arms, and that's what we stand ready and able to do. The key thing is for people to come forward. So we've done about 4 million booster jabs. There's, I think, just around 2 million more invitations that have gone out, and we say to people, please come forward and take that booster jab, and we will continue to ramp that up. The capacity is there, the supplies are there, so please do it. And that's why, in a sense, we've opened it up more, saying if you haven't been contacted, because it's a big logistical exercise, if you haven't, get in touch, which we hope will see more people coming forward.
My staff work very hard for me, and every Christmas I like to take them out for a Christmas lunch to reward them for their endeavours. Obviously, I wasn't able to do that last year. Will I be able to do that this year? Can I book the table now?
I would anticipate, if people do what they're doing, get those jabs, continue at pace, I would say, yes, you see the restrictions at the moment. There aren't restrictions on whether you could do that. So therefore, I would say, go ahead. You heard what Sajid said about the mayor and the fireworks, I think, on your show a few weeks ago. Now, I'd urge, get the jabs, be cautious, be sensible about this. But at the moment, we're seeing here, as Sajid put it, is a race between, and it has been every time I think I've been on your show since we've had the vaccine, a race between the disease and its replication and hospitalisations and getting the vaccine out. We're winning that race, but it's getting tighter, and that's why the focus is on these booster jabs at the moment.
Lastly, the Health Secretary said we should all be wearing masks or face coverings. I have to put it to you that when I've been watching proceedings or events in the House of Commons, you and many of your colleagues, well, not about you individually, but certainly the Conservatives don't seem to be following that line. Were you wearing your face mask in the House this week?
Well, I wasn't at PMQs yesterday because I was in a meeting about this and what we're talking about, but I did do health questions on Tuesday, and the short answer is yes, most of the time I was, when I wasn't answering questions. There will be times, I am sure, where I will have thought I was about to bounce up, so didn't have it on, or will have forgotten to put it back on when I sat down. But if you see me on the bench there will have been certainly a chunk of time there when I did have it on, when I knew I wasn't due to answer anything.
But just lastly, earlier this week, the very moving tributes that were paid to your late colleague Sir David Amess, I have to say many Conservatives were conspicuous by not wearing masks, Minister. Is the message now going to go around, come on guys, come on women, come on folks, we've got to get those masks on?
Well, if I can make 3 points. First one is just on that, and they were very moving tributes, and I should say we mustn't forget the moving tributes yesterday to my friend and colleague James Brokenshire, who I suspect was a regular on your show.
I'm actually
attending
the event later today. Yep.
I will see you there.
Okay, sir. To your other 2 points.
In terms of those particular points, what I think we've said throughout is, and you heard what Sajid said yesterday about leadership and people needing to reflect on their own decisions in this respect, but we are not at the point of Plan B, which is mandation. We are saying to people, here's the risks, here's the guidance, here's the advice, exercise your judgment. And my colleagues will do that, and I know they will do that responsibly and carefully, but they will form their own judgments. And that's where we are at the moment with this, because we haven't gone to the Plan D with B, with the injunction, with the mandation. We have been clear that at the moment we'll put the guidance there, but it's for individuals to exercise their judgment.
Minister, thanks for your time. Ed Argar, appearing here on LBC, Health Minister and Conservative MP. 3 to 8 the time. Let's talk face coverings, masks, whatever you want to call them. May in Glasgow. You still wearing yours, May? Good morning.
Good morning, Nick. Yes, I sure am. It's been mandatory here. It's never the wearing of face masks have never been lifted.
Yeah.
And our stats yesterday over 24 hours were 2,768 new COVID patients.
Right.
Now,
What was that like? I mean, is that higher than it was a couple of weeks ago?
It is rising.
Right.
Yeah.